The first law of psychiatry is there some medical condition that is creating psychiatric problems like depression, anxiety, mania, psychosis, OCD? Is there something physical going on? Because you can jump into therapy and psychiatric medications and spirituality all you want. But if somebody's suffering from a low-acting thyroid, for example, they're going to be depressed probably no matter what. Or problems with their adrenal glands, depression, anxiety. Let's say they have lupus, or they have Lyme disease, or diabetes, or they've had a stroke, or seizures, or they're taking certain kinds of medications, like propranolol for blood pressure. You can wind up with depression there. So you first need to look carefully. B12 deficiency, lung problems, breathing problems. You're not using your CPAP right, so you have sleep apnea, and that creates all sorts of mental difficulties and challenges. So that's the first place to look. A doctor or psychiatrist should never jump to just handing out psychiatric medications unless they first look into the physical, the medical background. Next, I'll be very direct here. If you go to a psychiatrist, the psychiatrist wants to prescribe medication for you within 5 or 10 minutes. Don't go back to that psychiatrist. It is ridiculous. It is ludicrous for somebody to come to that opinion so quickly and not to do a full evaluation and look at other ways of helping you rather than just doling out medications. Unfortunately, we live in times where people want quick fixes. People want medications right away. And the doctor, sometimes because they're limited by time, because the insurance payers are limiting their time or whatever, they rush to judgment. They just look at a list of symptoms. They check the boxes, so to speak. And then they say, aha, you're depressed. Because you said you're depressed, and now I'm going to give you Prozac. I would not go to those doctors. It goes without saying that a careful history of the patient needs to happen. You need to look carefully in terms of when they were young, their upbringing. Start with there. Were they raised by both of their parents? If they have siblings, what number were they in the order of their siblings? What were they like in school, in high school? Were they bullied? Were they bright? Were they putting on roles all the time? Find out about them, their history. It's key before you jump to some kind of a treatment. And when you look at treatment, I really believe that the first area you should look at is lifestyle changes first and foremost. For example, is the person drinking a lot of coffee all day long? Because that can have tremendous effects, creating all sorts of anxiety. Do they exercise? Many people are sort of lazy. They don't get themselves going. They give in to their inertia of not doing much of anything, and then they complain about it later on. Exercise is key. Nutrition is key. A Mediterranean diet, or are they having all sorts of sodas and fast food? Do you wake up every morning with a sense of gratitude, aware of the inherent blessings that you have in your life? Is spirituality part of your life? Do you know what you're here for? Do you have a sense of purpose, a sense of mission? All these things need to be looked at. Do you waste time? Waste time scrolling, like many people do all day long, just looking, playing video games on end. All a waste of time. Imagine Abraham Lincoln. I talked about him a few weeks ago, who suffered greatly from depression. He worked through his problems. We all have problems. We have depression moments. We have times of significant anxiety. But by working through those rather than brushing them over with medications, we actually grow so much more. If Abraham Lincoln had been given an antidepressant, I wonder if it would have blunted him. It made him less of a man, less of a president, less able to have the empathy that he had in leading our country through one of its most difficult periods. We need to be very careful before rushing to medications. Look at lifestyle, look at our attitude. Do we have a purpose? Are we connected? All these things are important. If people are not connected, if people don't have these things, then you can begin maybe first to take them through the journey of good therapy to help them to become more aware of who they really are, aware of how they can meet the challenges of life, aware of their strengths, aware of their weaknesses, and how they can work on them without swallowing a bunch of pills. Now, having said this, I do think there are certain conditions where medication can make a world of difference. I know there are people who are going to disagree with me. I know people are going to talk about side effects. I know people are going to talk about how simply taking a medication could be a placebo effect. And yes, those things are true. But I have seen over my past 30 years remarkable changes in people when they truly have certain conditions where medication makes a world of difference, where medication changes lives. However, once again, any psychiatrist or PCP has to be very, very cautious, very careful before they jump into the world of medication. They should first try the things that I've said earlier in this talk. What conditions? Well, certainly a severe depression. There are those people, I believe, and that I've seen who suffer from a true blue, palpable depression that lasts for at least 2 weeks in length, which has many of the features, the symptoms that go along with this, where sleep is affected, appetite is affected, concentration, a huge lack of motivation, low self-esteem, loss of joy in almost all the things that they normally would enjoy. Sadness that permeates day in, day out, not just for a day or two, not just because of the breakup of a relationship, but it's there, palpable, physical. And of course, in the worst cases, when they have a death wish, and then they start planning suicide. These are the people, the ones who think about ending their lives, who wind up in the psychiatric hospitals. And yes, if I'm convinced that they have this palpable, true biological depression, I will give them medications. I will first try sometimes, oftentimes, the other things, the exercise, the spirituality. If those things don't seem to make much of a dent, well, then we do need to give them medications, I believe. And medications can be ever so powerful and effective. Bipolar, also known as manic depression. I have seen, again, remarkable turnarounds. People in the midst of an extreme manic episode where they're spending tons of money on ridiculous things, where they're having all sorts of sexual encounters, where they're ruining their marriages as a result, where they're taking risks by using substances or driving fast, or they're standing up on a building thinking that they are Superman. They put themselves in danger. I see many of these people I've seen in the hospital. And once again, medication can make all the difference in the world, especially the gold standard medication called lithium. Do we need to be careful? Could lithium have effects on the kidneys and the thyroid? Absolutely. So those things need to be monitored closely. I just want to say there's a warning about antidepressants, which says it could create suicidal thoughts, and that is true. That does happen, especially, they say, in the teenagers, adolescents. So in those cases, it needs to be watched ever so closely. In fact, I would be very, very slow to give medications, any medications, to a growing mind, to a child or a teenager. I hardly ever do. But in the rare cases when I would, I watch them closely. I have them come into the office often and make sure they aren't falling into the abyss. Anxiety. I mean, anxiety is part of life. We all go through times of anxiety, and by working through our anxieties, we actually grow and can become stronger. But there's some people who suffer from absolute debilitating anxieties to the point where they have panic attacks. Their heart is beating, they get shortness of breath, they get dizzy spells, they think they're going to die, they run to the emergency room, they simply cannot function or cope. And again, I have found the power of the right kind of medication to help them so they aren't living in a world of being totally overwhelmed and non-functional. And yet again, when looking at anxiety, we need to look at the big picture. Somebody drinking a lot of coffee during the day, yeah, that may help them wake up, but then they go through withdrawal and can go through a tremendous amount of anxiety. If somebody using substances like alcohol, cocaine, that can create anxiety, again, going through withdrawal with the alcohol. So everything needs to be looked at. Again, the bottom line is a psychiatrist should be very slow and cautious before jumping to giving psychiatric medication. I'll go on the limb and say that I believe it's impossible to have a truly fulfilling life unless somebody is connected or aware, acknowledging, absorbing their soul. It all starts with that. No matter what's going on, no matter if you have the deep, dark depressions or you're just struggling with the basic challenges of life all the time, we are truly our soul, that part deep inside of us, that part of divinity, that part of godliness that is inside of us. I know some people say, how can a psychiatrist be talking about this kind of an issue? But I believe it so strongly. I've seen it impact so wonderfully so many of the patients that I've had the privilege of working with. It makes a huge difference. Otherwise, you're just sort of there trapped in the whims of time. You're become a candle in the wind, but here you are actually taking charge of your life. And then you're able to actually go out into the world and affect the world at the same time, which also will make your life more meaningful. And to learn the art and the science of response, that no matter what comes our way, as Viktor Frankl, the great psychiatrist of the 20th century, said, no matter what comes our way, we have the freedom to choose our attitude, our response. Now that is powerful. I do think the more we are connected to our soul, the more we are able to reach that powerful peak. So in the end, do we need to take psychiatric medications or do we not? Well, in certain times, they can make a big difference. I think anybody who says thou shalt never touch psychiatric medications will leave some people in a state of some type of danger potentially. On the other hand, certainly most people, I believe, do not need to be taking psychiatric medications. So as a psychiatrist, I've seen fire and I've seen rain. I've seen storms that break and storms that come again. I've seen souls get strong when going through the pain. So take meds when needed, but not for every drop of rain. Thank you.